Growth hormone is also called as somatotropin, which is secreted by the somatotrope cells of the anterior pituitary gland. So, this is the hypothalamus, the anterior and the posterior pituitary gland. It is bound to plasma protein and secreted episodically in periods of 20 to 30 minutes with large diurnal fluctuation, but regular nocturnal peak increases in growth hormone. The daily output is 0.2 to 1 mg per day. Plasma growth hormone concentration in a growing child is higher than in an adult. Actions of growth hormone. It helps in the growth of almost all the tissues in the body by increasing the size and the number of cells by mitotic division. It causes specific differentiation of certain types of cells like bone cells and muscle cells. This hormone promotes action on the liver and other organs. Secondly, it helps in the stimulation of the growth of the bone, cartilage, and connective tissue. It is responsible for differentiation and development of bone cells. It increases the growth of the skeleton, increases the length and the thickness of the bone. Growth hormone increases the synthesis and deposition of proteins by chondrocytes and osteocytes, thus multiplies the chondrocytes and the osteocyte cells by enhancing the intestinal calcium absorption. Thirdly, growth hormone also helps in the formation of new bone by converting chondrocytes into osteogenic cells. Availability of calcium for mineralization of the bone matrix. The growth hormone increases the length of the bones until the epiphysis fuses with the shaft, which occurs at the time of puberty. After epiphyseal fusion, the length of the bone cannot increase but stimulates osteoblast to increase the thickness of the bone. The fourth action is on metabolism. Protein metabolism. It is a protein anabolic hormone. It increases synthesis of proteins by increasing RNA translation, thus activates ribosomes to produce proteins. It increases transcription of DNA to RNA. It decreases the catabolism of proteins and promotes anabolism of protein indirectly by increasing the release of insulin, that is the effect on proteins. Effect of growth hormone on fat metabolism. It has a catabolic effect. It mobilizes the fat from the adipose tissue, increases the free fatty acid level, hence used for energy production. In gluconeogenesis, proteins are spared. Hence, ketosis occur due to acetoacetic acid production from fats. Effect of growth hormone on carbohydrate metabolism. Growth hormone is diabetogenic as it decreases the peripheral utilization of glucose, directly antagonizing the insulin effect on the adipose tissue and skeletal muscle. That is, it decreases the glucose uptake by tissues. Effect on mineral metabolism. It increases calcium absorption from GIT and decreases excretion of sodium, potassium, and calcium from the kidneys. Regulation of growth hormone. Growth hormone is stimulated by decreased blood glucose, decreased blood free fatty acid, increased blood amino acids, starvation or fasting, protein deficiency, trauma, stress, excitement, deep sleep, that is stage 2 and stage 4, testosterone and estrogen levels. Growth hormone is inhibited by increased blood glucose, increased blood free fatty acids, obesity, aging, somatostatin, somatomedins, exogenous use of growth hormone. Applied aspect. The first one is gigantism. It is the acidophilic growth hormone producing cells of the anterior pituitary gland. It becomes excessively active and results in overproduction of growth hormone during adolescence, that is, before the fusion of the epiphysis with the shaft. There is excessive growth of long bones, resulting in a tall stature as much as 8 feet before puberty. The second one is acromegaly. It occurs due to acidophilic cell tumor of the anterior pituitary gland producing excessive secretion of growth hormone during childhood, that is, after epiphyseal fusion. In some cases, it is associated with hypersecretion of prolactin. It causes growth of the acromal regions. Acromegaly means enlargement of the peripheral region. The person cannot grow taller, but the bones become thicker and the soft tissues continue to grow. The enlargement is seen in the cranium, nose, bosses on the forehead, lower jawbone, and portion of the vertebra. Prognathism is wherein it includes the lower jawbone protruding forwards, the nose size increases twice the normal size, hand size increases twice the normal size, feet size also increases, you usually see size 14. They require large shoes. They have extremely thick fingers, a hunched back which is kyphosis, the tongue, liver, and kidneys become enlarged. Then we have panhypopituitarism, where there is decreased secretion of all the anterior pituitary hormones. And the last one is dwarfism, which results due to deficiency of anterior pituitary secretion, or the rate of growth hormone is normal or high, but there is a hereditary inability to form IGF-1, that is insulin like growth factor 1, which is required for the promotion of growth by the growth hormone, and growth insensitivity, that is abnormality of growth hormone receptors.